Hi. Well, I was just interested in talking about breast cancer. It's become a big industry. Susan B. Komen fundraising has skyrocketed. They make lots and lots of money off fundraising, their campaigns, the pink ribbon, and then they go into the pink bags and uh, encourage everyone to get a mammogram and so forth. It's become a big, big industry with lots and lots of money, lots of security for lots of people in the breast industry. Nothing wrong with being careful, nothing wrong with checking even if you don't have anything wrong with you, but it has caused some problems for people who do have a problem. Lots and lots of people are getting mammograms, a lot of whom are only doing it because they are told they should, although they don't have anything on breast examination. So they get a mammogram. Now, to get a mammogram, most people are waiting 1 to 2 months because there is a lineup of people who are encouraged to get mammograms. So it's not a quick thing. It's not like you just sign up to get a mammogram, and before you get your mammogram, you have to go to see your primary care doctor. Now, we always think that mammograms are something you just request. No, in big business, you have to see your primary care doctor first. Okay, to get an appointment with your primary care doctor, you're probably going to have to wait 2 to 3 months. So now your mammogram is about 4 months or 5 months after you decide to get one. So your doctor sends you for a mammogram and you wait the 1 to 2, heavens forbid, wherever you're located, you might even wait up 2.5 months to get that mammogram. Then the doctor, if you have something, or if the picture's not clear, will tell you you need a diagnostic mammogram. Now you would think the diagnostic mammogram would be automatic. Heavens forbid, the doctor saw something abnormal. No, it's not automatic. You have to go back to see your regular doctor and get a request for a diagnostic mammogram. Now this puts more money in your regular doctor's pocket, and he's going to order it because what doctor is going to say there's something abnormal about your mammogram and he doesn't want you to get a diagnostic mammogram? So you go see your regular doctor, he orders a diagnostic mammogram, you go back, wait another month or 2 or 3 to get a diagnostic mammogram. Now you're about, maybe 10 months into trying to figure out what's wrong with that breast. So you go get a diagnostic mammogram and it says, you know, something or other. Either they see something or something might be there, something might be suspicious, or they might even call it normal. Well, depending on what you want to do next and what your doctor wants to do next, a lot of times they'll just tell you to come back in a year. So if you feel a lump and you know because you've been doing regular breast exams that it's not there and they don't see anything that's definitely cancer on the mammogram, the diagnostic mammogram, they might just tell you to come back in a year. Now, on their notes, they're going to write that they also told you to go get a breast biopsy and so forth, but they won't tell you that because they don't want you to continue worrying. They don't want you coming back too frequently and have everything negative. So they'll tell you to come back in a year, but in their notes, they'll also write, and let me put this back up, there you go. They'll also write that they told you to come back for a ultrasound. Well, they would have done the ultrasound with the diagnostic mammogram, but they'll also put in their notes that they told you to come back for a needle biopsy and so forth. But they won't necessarily tell you that. So this is where you have to advocate for yourself. If you've done a breast exam and you are unhappy with the result of the diagnostic because you know that something is different and unusual in your breast, you have to push for that needle biopsy and the MRI, magnetic resonance imaging. So they can do that of the breasts. Now, those are both required. According to current breast care, there is a flow sheet. You cannot get past the flow sheet if something is going on. All the doctors follow the same flow sheet. So after the diagnostic ultrasound and mammogram, they are going to send you for an MRI and a needle biopsy. Even if you have a definite lump there, you are not getting past these stages, so you can add more time on to your evaluation. Now, an evaluation for getting these tests might take a month, so that you might have a month's wait, even if it's urgent. An urgent might get you seen in 2 weeks to a month for evaluation. If it's not urgent, it might take longer. It might take 2 to 3 months. So now you're over a year trying to get this breast lump evaluated. Okay, so say the breast lump comes back cancer, invasive cancer. Well, according to what we see, like Sarah Ferguson of the Royals, who had her breast removed, she had a mastectomy. Heavens forbid, that's not what you're going to receive. You are going to have to go back to your regular doctor, the one that you've seen a number of times before, and this time he's going to have to do a pre-op physical exam. So you're going to have to wait, a couple of weeks to see him. Then he's going to look at you just like he looked at you before. He's going to write down that you need blood tests, chest x-ray, and an EKG. Okay, so after that, then they'll schedule you if everything's fine. Now, if something's wrong, then they have to do more tests before you even get that breast taken care of. But if you pass those stages, then you're going to have to wait longer because they haven't even scheduled you for surgery yet. So you're going to have to wait for surgery. How long will that be? Oh, that could take 2, 3, 4 weeks. So you are now about a year and a half after discovering initially that something is wrong with your breasts, and it is no wonder women are dying like crazy from breast cancer. This is absolutely ridiculous. Women need to be treated quickly, and I mean quickly. All of these things can be done by a good person or without these formulary flow sheets in a couple of weeks. But for the average person, and especially if you're a minority, you're probably not going to get anywhere near all this stuff. They're going to think you're exaggerating, and if you have very large breasts, you're just going to push you off to the side, and you can pretty much write your death warrant. You probably will not get adequate care in time. But yeah, they'll still throw you on chemotherapy and radiation therapy, all of which will make you sick, but will not extend your life any, but it will make you miserable, and it will help you contribute to the money that people are making through breast cancer. And this is the sad truth. This is the sad truth. So instead of having these flow sheets that doctors are finding, we need to identify doctors and systems who are allowing patients to come in, get quick therapy, quick treatments within about, even a month to me is too long, but maximum a month, not a year and a half, not 2 years trying to figure out what they're going to do about something that was essentially diagnosed as suspicious, highly suspicious, or whatever a year and a half ago. I'm going to do more about breast cancer because I think this industry is designed by men. I think it's designed by people who are profiting from the industry without regard to the patient. And I think the attitude of most of the people who are involved in breast cancer Treatment, diagnosis, and treatment are mainly involved with paying, getting money from the insurance, making sure that you are financially able to pay, making sure they get money. Well, they have to pay for those big instruments and so forth, so I see that money is there. But we need to put the patient first. We need to find out how to get the patient treated as quickly as possible. All the time you can be confirming that she has money somewhere to pay for these treatments, but we shouldn't be ignoring people for 18 months while we play the let's take more pictures of her tits breast I'm sorry, let's take more pictures of her tits game. All of these tests are fine for telling you, yes, it's really there. I got a picture here, I got a picture there, I have a pathology slide here, I have another picture there. But those pictures are what? You're going to make a little picture book? You don't need all those pictures. You need to see that something is there. It's suspicious. If it's suspicious, I can guarantee the patient wants it out as soon as possible. But that is not what we're getting from the medical industry. That is not what we want. We want people who are going to respond, be compassionate, get that diseased or highly suspicious or cancerous tissue out, and quit playing the breast picture investigation game. It's killing women. We all know it, and that's why breast care, even though we have a lot of procedures, breast care is very poor. Not only in the United States, I assume they've learned this in other countries, but I don't know exactly what the procedures are in other countries. We need to find out. What doctors are willing to work to help save patients quickly? We need to find out who they are, and we need to make their names and access available to patients who want quick, fast service. What do you think? Like and subscribe. Bye.